Hello, this is Dr. Scott Harrington coming to you live from my virtual doctor's office at veganprimarycare.com, where you can see a vegan doctor as your primary care doctor virtually from most US states. Not just as a one-time consultation, but as your primary care doctor, someone who gets to know you, someone who can be your health advocate. Because I'm licensed in most US states, even if you move, you don't have to change doctors. If you are vegan, then get a doctor who gets you. If you haven't adopted a plant-based diet yet, you are still welcome to be my patient. But beware, diet, exercise, and lifestyle changes will always be my first recommendation. My goal for you is to take control of your health. And through the power of a healthy lifestyle, we will work to heal your chronic conditions and get you off your chronic medicines. You may have heard our announcement that starting May 14th, we're going to add in-person visits due to the increased demand. And we will have an office located in Pinellas Park, centrally located between Clearwater and St. Petersburg, Florida. We will be co-located in Pinellas Park with an outstanding pulmonologist named Dr. Michelle Zatuni. She's a classmate of mine from Philadelphia College of Osteopathic Medicine and is graciously giving us some space we need to see patients in person. With in-person visits, you'll be able to have work and school physicals done as well as any specific in-person exams that you need. Remember that this content is for educational and entertainment purposes only. This video is not intended to take place of your own doctor's advice. Okay, we are live streaming on multiple platforms, ready to take your questions. There was a little bit of a hiatus. I was working with the Army for a little bit and got to serve, and so I'm back and ready to answer your questions. So we have several folks online. Hey, Jacqueline. Hello, how's it going? So one of the things I like to kind of introduce is sometimes I'll have questions that people have submitted recently or patients will bring up to me on how things are going and, you know, common questions. And one of the ones that comes up lately is, well, what do you struggle with, doctor? What, you know, you've been vegan now since 2012. And, you know, what were your struggles when you switched to plant-based? My initial problem was that I didn't eat enough carbs. I was kind of fearful of carbs coming from sort of the culture of, you know, we need to have a lot of protein. So I didn't eat enough carbs initially. So I was just eating vegetables and fruit. And I was feeling kind of bloated. I was feeling kind of tired. But then when I added carbs back, I felt great. I continued to lose weight. And so carbs are sometimes demonized, but really they're the cornerstone of your diet. So, but as I've gone through, the food addiction type symptoms come in, and the desire for sweets and things come in. So sometimes I'll be eating foods that are high carb and low in fiber. And in general, you want to try to eat a whole food plant-based diet. That's the healthiest. And so the way I need to tweak my diet is I have to decrease some of the high glycemic index carbs, like some, you know, I need to decrease my consumption of straight, you know, bagels and this sort of thing. But for the most part, when people are switching from the vegan diet over from an omnivore diet over to the vegan diet, I tell people, hey, don't worry too much about carbs as long as you're not eating sweets and pastries and things like that and cakes, because if you're eating low fat, you can get weight loss and that sort of thing. But as you start to narrow down and your focus gets better and better and your meals get better and better, then you can start to work on the high glycemic foods. So that's kind of my some of my initial advice today. Let's see. We've got Lori Pierce too. Okay. So Lori Pierce says, okay. She says, I can truly believe I can reverse my type 2 diabetes with a whole food plant-based diet. And that is true. That is true. So, you know, the whole food plant-based diet has been proven to reverse coronary artery disease, our #1 killer. And it is definitely very powerful for diabetes, one of our most common diagnoses. So sort of common sense for diabetes, since it's a problem with sugar, is to avoid all sugars. And so doctors will say, oh, you got to, watch out for all your carbs and this and that and sugars. And so, but my initial plan is to tell people, hey, you need to stop with animal products because they're high in fat. You need to watch out for your oil consumption because it's high in fat. And we've learned that over time that fat is an issue. They call it intramyocellular lipid, fat in your muscles, in and around your muscles. It's kind of like if you see steaks where they have marbling, they have fat inside the muscle tissue. This is kind of what's happening when people have type 2 diabetes. And the fat content creates an increased requirement for insulin. So it's kind of like the receptors for the insulin don't work as well. The fat has kind of gummed them up. It's an analogy for it. So the first step, eliminating animal products and dairy, high fat animal products, and watching out for fats in your diet. That's the first step, because if you can improve your insulin sensitivity, then your type 2 diabetes starts to improve and your sugars go down. Another tip, I got a chance to wear one of those long-term continuous blood sugar monitors called the Dexcom. As a doctor, I got a chance, a pharmaceutical rep showed me how it works and to tell my patients about it. And so I got sort of an inside scoop. I got to wear it. And I would find that when I was stressed, my cortisol was up, my blood sugar would be up, it would be high. And, if I had drank so energy drinks and, or Coca-Colas, just free sugars, just plain old junk food, my blood sugar would be up. But what would also happen is if I ate a fatty meal, my blood sugar would be up for a longer period of time. And so even within the same meal, the sugar, if you have a high fat diet, it will raise your blood sugar. The other thing, what caused the blood sugar to be down really well and controlled all day when I was wearing this thing, I don't have diabetes, I just was wearing this, is that when you exercise, I would go on a short run or do some, mild exercise. And the body has to take more blood sugar out of circulation and store it in your muscles, replenish your lost sugars through exercise. The glycogen has to restore it. So it will take sugar out of the blood and lower your blood sugar for hours after exercise. So these lifestyle changes have a great effect on diabetes. And so I know I'm kind of running around this same thing. Lori Pierce, I'm going to pull you up again here. Lori Pierce says, fatty liver. So she's highlighting the fact that when people have diabetes, the marbling that happens in the muscles is happening in the liver. Once the liver kind of fills up with fat, the body will try to store fat in other places, visceral fat inside the abdomen, fat around the muscle tissue. Okay. Good point, Lori. Okay. If you're watching on different platforms here, it seems like most folks here on Facebook, go ahead and give us a like. If you like what you're hearing, go ahead and smash the likes for me. Okay. Let's see what Deanne says. My grandson is 13 months old. Sounds like stuff in his chest. Took him to the doctor. He did nothing. Said it was virals or something I can do at home. I've done steam shower and it didn't work. So, I mean, certainly you want to have a doctor that you're talking this. I'm not providing advice outside of your doctor visit, but viruses in small children is very, very frustrating because especially infants are obligate nose breathers. When they're breastfeeding or when they're sucking on a bottle, their mouth is closed and their mouth is distracted with feeding, and so they're having to breathe through their nose. And if it's stuffed with mucus, they can look like they're struggling to breathe, and they can stop feeding as well during these viral illnesses. So the key is watching out for shortness of breath and for feeding. If the child's not feeding very well, and you can't do a bulb suction on the nose and get feeding better, then you may have to take your child in, your grandson in, to be evaluated again. Sometimes you can even listen to the chest, almost like, a doctor uses a stethoscope. They're listening for crackling, and you can you can just put your ear to the chest and hear if there's crackling. You may be hearing the crackling from the nose, the gurgling. So, you wait for them to cough or something like that, and then you listen, and you can hear if there's fluid in the chest. You can practice on somebody else in the family and who's not sick, and you can kind of learn, oh, this is what it sounds like. That's a little kind of home tip for people can listen to, just like what a doctor does when they listen for pneumonia symptoms and the sounds in the lungs. So another thing that is underrated with viral illnesses. I know this is COVID season, and I'm not saying this is a cure for COVID, but with viruses and colds, one of the things that is very important is with all this nasal congestion, nasal running, is the idea of nasal washes. Now, I don't know about you. I don't know if you've experienced this, but a nasal washer, the neti pot, these things where you're squirting up the nose, this is underrated. It is actually amazing in terms of, it's a little bit uncomfortable, but just rinsing the nose will help you wash away viral particles. It works really well for allergy season. Instead of trying to medicate yourself with all these medicines and antihistamines and stuff, you percolating a little water up into the nose, and it rinses the nose, and then you'll start getting more, your nose runs for a little bit, and it basically rinses your nose. If you decrease the viral particles, you get better faster, and it helps open you up. It's a good thing to do maybe like right before bed, so you can breathe easy and help you fall asleep. Okay. Okay, Leah says, which vegan prenatal supplement do you recommend for someone trying to conceive or trying and to continue throughout pregnancy? I don't have a recommended specific prenatal vitamin that I recommend. So I'm sorry, I don't sponsor or work with a specific prenatal vitamin. The standard advice is for people to take prenatal vitamins. You may want to look for, I'm vegan primary care. You may want to look for one that's plant-based, but that's a good point. I can try to find a preferred prenatal. Sometimes I'll get advice from Dr. Bussi. She's a pediatric doctor, and she has a lot of advice on different vitamins and stuff for kids. And so I bet she has a recommended prenatal on there as well. I will check that out, and I will upload it for you, Deanne. We can put it on our website or on Facebook. Okay. All right. Be sure to add your questions on there if there's anything that you want me to discuss. One of the things that I wanted to go over that people have mentioned is, Doctor, I don't know about this telemedicine thing. This telemedicine, how are you going to do an exam, and how do we do certain, if I have something wrong with my heart or my lungs, if I see you, I won't be able to get this part of the exam done. And that's true. There are limitations to telemedicine with this straight video Zoom type call or FaceTime type call. There's limitations. I can't listen to your heart or lungs. So when people have an emergency, something's wrong, I have to recommend they go to an urgent care. But most primary care can be done online in this scenario. But if folks live in a very rural destination. They're really far away from other doctors, and they want to use telemedicine as their main doctor. There are new devices out that can help, that can record your lungs and your heart and can look in your ears and your throat. There are devices, and I partner with a device company called TytoCare. And I know this is a little bit low tech here, but I've taken a picture of the TytoCare device. This is definitely low tech, but as you can see here, it's a device. It has an otoscope, and it has a tongue depressor, and it has this device here where people can put it to their heart and lungs, and it records it. And then you send it to me or other doctors, and they can get the exam, every part of the exam, for the lung, for the heart, for the ears, a tongue depressor, for the throat. You can take pictures of derm lesions and things like that. It's called TytoCare. I do not have stock in TytoCare. I don't have an affiliate with TytoCare. So it's just, I know that it's worked, and it worked in the past, and I've experienced it. It's a great product. It's about $300. They've given me a $75 rebate that my patients can send in. The code is VPC for Vegan Primary Care. That's what you use and the discount. But also, sometimes you'll find even or they're running a different discount. So it's about $300, and then you can get those different discounts. Right. Yep. So we're not affiliated with them in terms of, we don't get kickbacks, I guess you could say, for the device, but the device can really make people feel like they're really connected. They're really connected to me. If they have a question, they do the exam, and then they send it to me and say, "Hey, doc, I've sent you the exam," and we listen to it and look it up, and I can help give you advice if things are more severe. Like ear infections is a classic one. Hard to deal with, hard to know how bad an infection is, but this device will help lead you and tells you exactly how to position. And when it takes a picture of the eardrum, it'll tell you, the little AI will tell you whether it's a good picture or a bad picture and tell you to reposition. So that is really cool. I mean, it's the wave of the future. In the future, I don't think people will be going into their doctors all the time. They'll just be doing these things at home, and more apps will be with your phone and that sort of thing. So it's called TytoCare. I think it's a great product. Okay, we've got a question from Nancy Shire. Hello, Nancy. My husband has had his 6th hip replacement with titanium rod. He's 76 years old, young. Should he be taking calcium, and if so, how much? Okay, Nancy, good question. So folks that have bone disease and bone degeneration are told to take 1,200 milligrams of calcium per day. So the problem is that as doctors, we've been telling our patients to take calcium, take more and more calcium. It was a standard sort of recommendation that doctors told people in the past. But when they do these big population studies, like the Nurses' Health Study, they found that folks that were taking high doses of calcium had higher rates of blood clotting and heart attacks. And so it sent us in a panic, the doctors, about what do we do? Because we know that calcium is good for bone health. And so what I recommend my patients do is to go online and get set up with that app called Chronometer. It's a free app, and you can load in your food and do a food log for 1 to 2 days. Food logging is very labor intensive, and it's easy to forget and not do it. So just strap yourself down to 1 day or 2 days, write in the food that you eat, and it will help you calculate the calcium content of your food. And so the goal is to get all of your vitamins from the whole foods. Whole foods will present the vitamins and minerals to your intestinal tract like it's always been meant to be presented. That's how your body has evolved, to accept those different nutrients. You know, with the, well, 1,200 milligrams, see, based on your calculations from your food log, how much of the calcium that you're getting through a normal, typical day. And then just take a supplement that will get you up to about 1,200. So lower dose is better than high dose, you know, supported with your normal diet. It brings up the point about the idea of reductionism. And when we do scientific studies, we have to take one variable and you know, adapt it and look at, you know, narrow it down and reduce different distracting variables and think confounding factors. And so when we've discovered vitamins and we've discovered minerals, a lot of times, you know, it's one vitamin and one disease associated with that, and taking that vitamin will cure that disease. But what we don't realize is that there's a symphony at play with all the different vitamins and minerals and phytonutrients. And a lot of times we miss the boat. We miss the boat. So we don't realize the effect that all these things happen together. So we've learned that things like in smokers, they knew that smokers that had higher levels of vitamin E in their blood, beta carotene in their blood, had less lung cancer. So they decided to give high dose beta carotene in pills to try to prevent lung cancer in smokers. And what they found was that the people that were taking it in pill form had higher rates of cancer. So it was not intuitive. We weren't expecting that. And so what we've learned is that the best thing to do is to consume the vitamins and minerals through your whole food, plant-based diet. And it's much likely to be safer and more healthy. Good question, Nancy. Okay, we've got more questions here. Let me thumb through them here. All right. So we've got Lori. She says, oh, look at these devices like the Taito Care device. Can these be used to do a sleep study? Are there devices that you can use at home to do a sleep study? Yes, there are devices that you can go online and find home sleep studies. The question is whether the home sleep study, what happens once you do the study. They've got these great devices. They're about the size of an iPhone, and you wear them. They put them right next to your bed, and then you wear a pulse ox, and it records your snoring and does the pulse ox. And kind of like, you know, the different devices like the Apple Watch or Fitbit will monitor your sleep. Well, this one is designed to rule out sleep apnea. And so they do have these devices. There's several companies that do that online. More and more stuff is going to be able to do it at home. However, you may need to have a sleep specialist interpret it and help you get the right CPAP device if you were positive for sleep apnea. So this is a great question. Sleep apnea is a scourge on our population. Lots of people have it. And if you're not getting good sleep, you are really having health problems. The analogy I use for sleep apnea is when you're holding your breath at night because you're snoring. You go through these intermittent bouts where you're holding your breath because it's hard to fight a restricted airway. And so you'll temporarily hold your breath till you wake up a little bit and take a breath like that and then fall back asleep. And so this repeated breath holding, then big breath, and then going back to sleep is like in the James Bond movies, people will hold someone underwater and they'll say, "Who do you work for?" And they'll put them back underwater. This stress, can you imagine the stress of going through something like that just while you're sleeping? You can imagine you're not getting restorative sleep, having headaches throughout the day, falling asleep at the wheel. This is a real big problem. So if you feel like you might be if people tell you you snore, if people tell you, or if you're falling asleep during the day frequently, a risk factor is weight. If you tend to be higher weight, you snore at night, or you drink at night typically, and then you snore real loudly. These things can cause sleep apnea, and you should get it checked. And some of these online devices is a good plan to try. Okay. Thank you, Lori. Okay. Deanne says, can you send us a link? Yes, I can. TaitoCare.com. Boom, boom. Here we go. Okay, there's the link to the TaitoCare device. Okay. Okay, Tarsha says, do you have a suggested meal plan to reverse type 2 diabetes? Okay. Tarsha, so this is a great question. You know, I don't have a specific meal plan where it's step 1, step 2, step 3, because there's so many places out there that have great meal plans. There is a 21-day kickstart through PCRM, Dr. Barnard's group. This is Physicians Committee for Responsible Medicine, PCRM. They have a free app, and it just tells you, you know, day 1, what to eat. There's no really specific, you don't have to have a specific diabetes diet if you're eating a low-fat, whole food, plant-based diet, because that is the diabetes cure diet. It's not only the diabetes cure diet, it's the diet to prevent multiple sclerosis flares and ulcerative colitis flares, and, you know, decrease asthma symptoms and help you with your cholesterol. And it's one diet to rule them all. So that's very good news. Now, there's also groups called like Mastering Diabetes, masteringdiabetes.com. They are two health professionals who have type 1 diabetes. And by having type 1 diabetes, you know how much insulin you have to take every day, because your pancreas doesn't produce insulin. So these folks over at Mastering Diabetes have a great plan, and they're experts because they themselves have type 1 diabetes, and the diet that helps with type 1 also helps with type 2. The diet to decrease your own insulin requirement works for type 2 as well. So these are great resources. These are great resources. Okay. So, Sophia, I've been getting burning in my chest. Started after a 3-day cleanse, finished a cleanse over a week ago. Can you help with that? How can I help with that? Okay. All right. So I'm kind of a little confused about, you know, what you mean by a cleanse. In general, the good news is we don't have to do specific GI cleanses because the body is kind of self-cleaning. You should eat a high fiber diet. Sometimes people will do certain fasts and things like that, you know, that might be appropriate and reasonable. If people are dealing with chest pain, certainly chest pain, you'd want to have that evaluated. You want to have an EKG. You want to see a doctor, especially if it's chest pain on exertion. That's very scary. Of course, we worry about the heart. If this is typical symptoms that you experience after meals, you're eating a fatty meal and you have heartburn, you can determine this pretty quickly with antacids to see if you are experiencing heartburn or not. So I'm not sure exactly what you may be going through. If you would like, make a visit with me and we'll go over it specifically. I would love to help. Okay. So help from our sponsor. Okay. So, okay, we've got lots and lots of folks. Okay, Robbie and Cyrus. Robbie and Cyrus are the folks over there at Mastering Diabetes. I just wanted to mention that. Someone put it in the comments. Thank you. I think it may have been Sophia. Okay, we've got a question from Ryan Roush. Hi, Doc. How are you doing, Ryan Roush? I know you spent some time in the military. How can you stick to a strong diet when you are limited to what is offered? Okay. Yes, I am in the military. I'm in the reserves military. I've been active duty. I've been deployed for over 2 years and 3 months in Afghanistan and 6 months in Kuwait. So when you're at a base that has a big Air Force presence and a big, airfield, the military is real good about providing lots of food options, fresh fruits and vegetables, and you should have no problems in the military. The military is big in health and nutrition. So that's not a problem. Now, I will say that if you are in a remote location that does not have access to fresh fruits and vegetables, they have meals ready to eat. Meals ready to eat. And the meals ready to eat have a lot of calories, and they're a very robust system. They're great for people who are going camping. Sometimes they'll buy them. But a lot of the meals are either vegetarian or like an omnivorous meal with meat and cheese and stuff. So I'm not sure if there's actually vegan packets for meals ready to eat. They have a center pack with the main meal for that pack, and usually that contains some meat or cheese. But there's there's like crackers and various other side items in these meals ready to eat. So the answer is yes. You just adapt. You kind of adapt to what you're given, and so it's definitely don't make your dietary change recommendations based on whether you're in the military or not. You should do it based on health, and the plant-based diet is the best diet out there. So for those in the military, if you're here and you're from the military, I recommend the movie Game Changers, because Game Changers, it's kind of geared toward folks who are interested in performance, and you see a lot of gold medalists and strength trainers and fighter types, and how the plant-based diet has helped them in performance. So watch the Game Changers and get back to me and let me know what you think. All right. Thanks, Ryan. Okay. So we have come to the end of our broadcast. There was a little hiatus for 2 to 3 weeks. You can expect every week, Wednesday, same time, same place for the month of May, at least. If you haven't already, smash the likes. Smash the likes for me. And overall, thank you for participating in this live event with me, Dr. Scott Harrington, in Vegan Primary Care. I look forward to doing a weekly broadcast and answer your questions. Thank you for your questions, and I look forward to seeing you next week. Bye-bye now.